Hello and welcome. The general consensus of getting seriously hurt or sick is going to the hospital. That process has been somewhat altered in the last 6 months due to COVID-19. To help us shed some light on that topic and everything related to it is Ann Brown, the Director of Patient Experience at Cone Hospital.
Thank you, Brian. I'm glad to be here today. So, yes, the past 6 months have been very different for us in our integrated healthcare system at Cone Health. And there are many things that have changed. I think when we look at what has changed for our patients, first of all, when this started, we immediately canceled all elective procedures. And that decreased our volumes in the hospital. We saw a decrease in visits to the emergency room. And we have been able to focus on how we can keep our patients and staff and providers safe. So a lot of our initial work was focused on that, so that anyone that came in our doors, our cleaning procedures were the ones that were recommended by the CDC, that we were using all of the precautions that had been shown to work, like the universal masking, screening, social distancing, etc. So that has been our world for the last 6 months. And we have been practicing those measures and educating our public, continuing to educate our patients. And that has been probably the biggest change for us. It also changed our visitation. We limited all visitors initially as we were trying to get our arms around the best way to keep our patients safe. We have loosened those restrictions as of July. We are now allowing one visitor for each inpatient, or a patient who's coming in for a procedural visit or ER visit. And that we know the patients value having a family member there or a designated support person. And our staff and providers also want the family present as well, so that we can help get that family member involved in the care. So it helps us to have that family member back. And again, we're just focused on making sure we do all of the safety measures so that that visitor is safe and the patient and staff are safe.
Tell me about selective procedures and what that entails.
Typically, those are the non-emergent procedures like elective joints, like a hip or knee replacement, something that was not an emergent surgery. Some of our heart procedures that were not considered emergent were delayed as well. Procedures like endoscopy, which would be colonoscopy procedures, those things were all on hold unless they were urgently needed.
Tell me about the cleaning procedures that you have in place now.
Well, we do much more frequent cleaning in our waiting rooms, our restrooms, and in our patient rooms. If a patient has COVID or they were to rule out COVID, we do have much stricter cleaning regulations, and we do have a special ultraviolet robot type equipment that will go in the room, and it is the best technology that we know of today to be able to really get that room sanitized and cleaned for the next patient. It has increased our cleaning times a little bit. It's about a 90-minute process, but it's the best thing that we can do to be sure we continue to keep our community safe.
And is there anything specific you would use that type of procedure for?
For the cleaning procedure?
Yeah, for that robot.
Those are used for the rooms where a patient has been COVID positive. And so once that patient is discharged from the room, we would do those cleaning procedures, as I mentioned.
We talked about the importance of family. How important is it to have that family interaction and the importance you place on that?
Well, for family members, again, our priority is safety. We want to keep everyone safe when they come in our doors, and we want our staff and providers to be safe as we added visitors to our campuses. So all of our visitors are expected to self-screen, if you will, before they come. We really discourage any any visitors that are high risk categories, or children are not allowed to come in. We only want patients who are, visitors who are healthy to come to visit our patients. We do screen the visitors with a temperature check. They are required to answer some basic screening questions. They're required to use hand gel, and they're required to mask. And we provide a mask if the visitor does not have an appropriate mask of their own. And the mask does have to be on the entire time they're on our campus, even in the patient room.
We talked about what visitors can expect when they come in. What can a patient expect when they come into perhaps the emergency room, for example?
Well, if you're coming in the emergency room as a patient, we assume that you definitely need to be there. So you will come in and check in like you normally would do, and you would go to our triage area, and a nurse would do an assessment, take your vitals, and if it's determined that potentially you could be COVID positive, then we would put you in a room and start doing the test. For our patients who are there for other reasons, they would be triaged and then be placed in a treatment room as it became available.
Mm-hmm. And I think
we talked about triage as well that you mentioned. Can you tell me how triage works and how that priority of care is assessed?
Well, our triage nurses and staff are really looking at the acuity of the patient. So the presenting signs and symptoms that a patient has will be assessed by that staff member. If it is clear that the patient is having potentially a heart attack, or they're extremely short of breath, or something clearly is not right from a mental status perspective, the acuity level would be increased. And we triage our patients based on acuity. So a major trauma would get priority over someone coming in with mild flu-like symptoms. So we triage based on the presenting symptoms.
Tell me about your separate campus for COVID patients.
And you're referring to our Green Valley campus?
Yeah, your Green Valley campus. That's exactly,
yes. Yes, we did set that up in April, and most of our COVID patients are on that campus, and that has helped us to efficiently provide the highest level of care for those patients and to have a dedicated staff and dedicated providers who are working with those patients. And many of our services that we offer in our other acute care hospitals are offered there. And that has really worked well in how we have been able to efficiently treat those patients. And we will keep it open as long as it makes sense to keep it open.
Is there anything being done differently? Any kind of precautions being made for those that might be in the high-risk category?
Are you talking about if they present with COVID symptoms? Or
no, just
anybody
just protection,
risk?
just protection in general for them.
Okay. Well, we would offer the same safety precautions that we would for all of our patients, even for a patient that may be high risk. If they have a lot of comorbidities, which can put a patient at high risk for COVID, they will be assessed just like anybody else would. And if there are indications that, in addition to their comorbidities, that they may be showing some kind of sign or symptom that could possibly be COVID, then we would do the appropriate testing.
In Guilford County, we rose to over 7,000 cases. What does this look like for Cone Health?
Sorry.
Well, what we have seen is really a steady state over the past few weeks. We had an increase in the early summer that had concerned us very much, but over the last few weeks, we're just sort of holding steady. We may see some decreases over a couple weeks and maybe a slight increase. We're waiting to see what Labor Day fallout may bring us, because we do anticipate we may see an increase given what we've seen on the news about social activity during Labor Day. But we have held fairly steady. on our cases in the hospital. So I would say steady with a slight decline on certain weeks, but the good news is not big increases.
I see that there's also virtual care. Tell me about that.
Certainly. Yeah, that was really one of the silver linings of COVID, was our ability to be able to quickly pivot and increase the number of virtual options for our patients. And we saw a tremendous increase in our medical practice setting for virtual visits. And it really met our needs of our patients so that they were able to talk to a provider and be treated, if possible, over the phone, or they would come in if the doctor deemed that necessary. And we have seen that as I think, a glimpse into what our future really is going to look like in healthcare, that we will continue to expand those options. You know, we have had telehealth visits in our emergency room prior to COVID. So we know the convenience factor for our community is really important, to be able to offer the virtual option. And we'll continue to explore what other ways we can use those services to make it convenient for our patients. You know, many of our community members may have transportation difficulties in getting to care. And if it's something that's non-emergent, but they need to get some advice from a medical provider, it just provides a really great option for those community members who are seeking medical care. So we'll continue to look at that and analyze that, and just continue to offer what we believe brings our community the most value.
Yeah, that may be the future of our healthcare system.
Yeah, absolutely.
If you need to be tested, or if you want to be tested, how can that take place, and where can you go?
Okay, there are several places in the community that testing is offered, and you can go to our Facebook page and look at the event section to get more details, or our Cone Health website.
I understand volunteers were limited. Can you tell me about that?
We did pause our volunteers when COVID started, and we have now offered our volunteers the option to come back if they feel that it is appropriate for them to come back. You know, many of our volunteers are at risk because of age or comorbidity, and some have chosen to stay at home. We have had some volunteers who have come back, and we are offering them, of course, the same safety precautions that we do our patients and visitors.
Okay, cool. And do you have any need for, I saw it on the website, for donations. Are you still in need of donations for medical supplies, masks, things like that?
I am unaware of any particular supply need that we're getting, we're soliciting donations for. However, we certainly appreciate any financial contributions that go towards the care that we offer our patients who may not have the means, or to purchase things for our community in the areas of our city that don't have all the resources they need. So our philanthropy and institutional development efforts certainly appreciate contributions to those initiatives.
Okay.
Now, I know we focused on the emergency room, but Cone Health offers a wide array of services. Emergency room, we talked about ICU, childbirth, cancer care, physical therapy, weight loss, nutrition, orthopedics, and it's inside of each of those categories is another specific category. Am I leaving anything out?
Well, I think you covered a lot of it. You know, we are an integrated health system that includes acute care hospitals, outpatient, ambulatory medical practices. We are considered a center of excellence for several services: our cardiovascular services, our stroke service, our orthopedic, our cancer care, oncology services, and are very strong. And we are recognized for our care in those areas. And being the size that we are, you know, we are a level 2 trauma center. So we offer a multitude of services to the community. And so we have a lot going on our campuses, and a lot of patients that we're serving.
Mm-hmm. And I understand you yourself were a registered nurse
I still am a registered
You
nurse.
still are? I'm sorry. Yeah, I was going through. You were registered. How has, other than the COVID, of course, how has the healthcare system changed from what you've seen?
Well, I think whenever you have a situation that you never anticipated to come up, you don't know how you're going to respond. And so we had little time to prepare for what COVID brought. And I think what has made me most proud, not only as a nurse, but just as a member of the Cone Health family, is how quickly we were able to identify what we needed, and we started responding. I think the challenge for us was that every day we were learning new things. You know, we did have the advantage of cities like New York and on the West Coast who were going through this before we did. So we were able to glean a lot of learnings from their experiences, and we had to change very quickly to adapt. And I think we did a really good job given that we couldn't prepare. And I think it has shown all of us that we can be very resilient and we can be very responsive when something comes up that we were not expecting. And I think it's made us a lot stronger because we have been able to do the work that needed to be done for our patients and community.
What would you say to people who are perhaps apprehensive about going and taking care of themselves or getting some kind of treatment, maybe because they're sick or anything in that realm, because of the COVID, because of they're afraid of getting it?
And we understand some of the community's hesitation around seeking care because they want to be safe. And our message is that if you need care, do not delay your care. Because if you put your care off, you could potentially be in a more serious situation because you did not seek treatment. And we are really clear about all the things we're doing to keep our community safe when they enter our doors. And we have information on our website about all of the things that we are doing. And some of those I've already mentioned to you, but to assure our community that seeking care is critical. Delaying care is not a wise decision, and we want our patients to come in to see us when they have a need and to be confident that we will keep them safe while they're with us.
Well, thank you so much for being on. I really appreciate it.
Thank you. You're welcome. Nice to talk to you.